Hi, my name is Erica, and I'm here to talk to you about Lynch syndrome, a very brief overview of Lynch syndrome. What is Lynch syndrome and why is it important? Well, it all starts with a quick history lesson starring a few scientists, Dr. Aldred Scott Worthen and Dr. Henry Lynch. In 1895, Dr. Aldred Scott Worthen thought that it didn't make much statistical sense that members of the same families were getting the same types of cancer. So he surveyed such families to create a family tree involving types of cancer and similarities between these families. He suggested that there was some form of heredity for certain cancers that were presenting at earlier ages than normal. Dr. Worthen passed away in 1936, and his fellow colleagues continued to study his findings. Then 30 years later, Dr. Henry Lynch decided to continue Dr. Worthen's study of the same family. He decided to investigate the genetics of this family and then concluded that there was an autosomal dominant inheritance pattern of inheritance where one person has a mutant gene and one normal gene on a pair of autosomal chromosomes. Over his lifetime, Dr. Lynch studied more than 3,000 families, thus this became Lynch syndrome. Interesting fact, it wasn't until 1993 where the gene was linked to specific chromosomes. Now, what does Lynch syndrome mean at the cellular level? Lynch syndrome is a mutation in the mismatch repair genes that cause the cell to overlook mistakes made in DNA replication. The cell cycle involves phases called G1, G0, S, G2, and the M phase. In essence, G1 is where a cell grows larger and prepares for DNA replication. If DNA is not damaged, it heads to the S phase. If it is damaged, it may be sent to the G0 phase. G0 is a resting place for cells to hang out until they are signaled elsewhere, or sometimes a permanent residence for cells that conduct signals, store nutrients, etc. The S phase is where DNA replication takes place and mismatch repair genes check DNA to make sure it is replicated completely and without error. Now the G2 phase is where the cell continues to grow and prepares for mitosis, and the M phase is where cell division occurs and the cell splits into two daughter cells. Let's take a closer look at the S phase of DNA replication. This is where we meet the mismatch repair genes that act as a spell check for errors in DNA. If they catch an error, they will fix the cell or recognize that it can't be fixed and the cell may die. It's bad news for the cell, but good news for you. In Lynch syndrome, there is a mutation in the mismatch repair gene that causes them to overlook errors in replicated DNA. This results in an increased rate of mutation and increased rate of possible cancer formation. This means an increased rate for certain types of cancers at a much earlier age than typical patients. Cancers associated with Lynch syndrome are typically colon cancer, endometrial cancers, cancers of the bowel, urethra, stomach, and ovary. Specifically, a 60 to 80% risk of colon cancer for those diagnosed with Lynch syndrome, a 40 to 60% chance of endometrial cancer, and a 5 to 10% chance for bowel cancer, urethra, stomach, ovary, and sometimes brain cancer. How do medical professionals and patients combat Lynch syndrome? The good news is that with constant and developing research, genetic testing can assess if an individual has Lynch syndrome. You may want genetic testing for Lynch syndrome if your family has a history of colon cancer and endometrial cancers, if a parent has had one or many of those cancers, and if those cancers in your family were early onset prior to 50 years of age. In the case that a patient does test positive for Lynch syndrome, there are many resources of medical professionals to guide them through preventative care plans. Preventative care is one of the most effective ways to proactively confront Lynch syndrome. These measures often involve yearly screenings of colonoscopies, endoscopies, ultrasounds, endometrial biopsies, and some medical professionals advise surgical procedures to further prevent cancer. Research suggests keeping a healthy weight as to not increase the already high statistics of contracting a cancer associated with Lynch syndrome, eating a primary plant-based diet, and some additional research suggests that a daily intake of baby aspirin may reduce risks. However, this is information that's best outlined by a practitioner dedicated to a specific patient's test results. Taking preventative care measures are highly effective in detecting cancer early. That being said, there are many communities that do not have access to preventative care due to financial stress, language barriers, religious beliefs, lack of education, immigration status, etc. While there are certain measures taken to combat this, such as over-the-phone interpretation, genetic counselors, and various hardship programs, there is still a long way to go to provide education and quality care to underserved communities. You can take a part to help by volunteering at the American Cancer Society. Some of their volunteer programs include helping to legislate federal and state cancer laws or driving patients to and from their appointments that do not have access to transportation. For further in-depth information about Lynch syndrome and how you can help, visit the references listed in this next slide.